Hi, I'm Rachel, and I'm here today to talk to you about trigger point therapy and chronic pain. I personally experienced a lot of chronic pain in my jaw as a child. I was sent to different dentists and specialists and no one could help me until I personally did some training in dry needling techniques with a sports physician, and it actually healed my jaw and opened me up to a wide range of different treatment options for dealing with pain. So what I want to explain to you is a little bit about trigger point therapy. Now, trigger points are knots or irritable spots in muscles or tissue that become really tight, and it means the muscle can become quite contracted and painful. And this is why throughout our body, if we have an injury or we fall over or we just have muscles that are overused for different reasons, they can become tight and inflamed and develop these trigger points or knots that you can see throughout the whole body. If you can imagine getting a trigger point, say for example, in the front of your leg, this can actually refer pain down and present as pain in your big toe. So it's really important when you're dealing with pain to actually look outside the box. You know, if you're not getting any really good results in treating the area that's painful, you need to sort of develop a relationship with a therapist that will look a little bit differently and find some other areas that might be causing your pain. So one of the biggest ways that I find is very therapeutic for healing trigger points is with dry needling. So dry needling involves the insertion of acupuncture needles into these tight muscles or trigger points that you see here. And they're very fine needles, and it's not often painful as such. So the needle itself isn't that painful. Sometimes when you're hitting that irritable point, it can become, quite sensitive and feel like a bit of a shock sensation. But I can guarantee that, once you've had the treatment, the muscle itself will feel much less painful to touch afterwards, and your recovery is much faster. So the needles are super fine and they just go into the muscle, and usually we move them around a little bit until we get or find a nice release in the muscle there. And trigger points therapy has been used for many years, and it can be used all over the body. So when I had it first done to me, it was actually in my jaw, and the pain relief was almost instant. And so we also use laser therapy, which is a cold laser. The one that I use in my clinic is the RainCorp laser, and it's super safe. So one of the fears with laser is sometimes with heating laser, it can actually burn the tissue, but this is actually a cold laser. So it's extremely safe. It can be used on babies. We even get young children, tiny young children here with different foot muscular deformities that it can actually help release those tightness in the muscles. We just use it for a minute on, different areas, anywhere from 30 seconds sometimes to a minute. And it's extremely safe. And some of the benefits of laser is it actually can help penetrate through scar tissue and release and soften scar tissue. It actually works on a cellular level, so it actually helps to repair healing, move fluid through trauma and damage, and have a really good basis for improving recovery, much like acupuncture. So my personal two favorites are to use these two together. So if anyone has a needle aversion, sometimes I always say just use the laser. But usually if children come in, I'll usually start them with the laser, and with that I also use a bit of both. And I find that gives me really good results for healing chronic pain. So I hope you found some of those tips useful, and if you want to find out more information, you can read my blog. Thanks.